Hi, my name's Ben Prince. I'm anaesthetics clinical fellow working at the Grange University Hospital. So I've introduced a intervention along with colleagues where we're trying to reduce the use of IV paracetamol where oral can be used. How we've done this is we've used the Omnicell automated medicine dispensing units, and we've introduced a prompt for when nurses go to select IV paracetamol. A little notice comes up to say, have you considered oral paracetamol instead? Giving patients oral medication is widely known to increase in patient safety. There's also benefits cost-wise. So with in the Grange, our projected savings over a year is about £13,000 with our intervention that we've done. Similarly, in terms of sustainability, we're going to have plastic savings, and one of these blister packs contains a number of different doses for patients, whereas one dose of IV paracetamol includes the plastic bottle and the giving set. And so with our intervention, we're having projecting savings of about 400 kilos of plastic per year, the equivalent of 700 kilos of CO2 per year. And we identified that lots of patients were getting IV paracetamol when they could be getting oral or enteral paracetamol. And lots of studies have demonstrated that there's no real difference of efficacy between the both. So feedback from the wards has been really good. I think we've tried to make sure that nurses are empowered to make their own decisions about their own patients. With those really good results, we've then expanded it to hospital-wide at the Grange, and we've recently just expanded it to the health board. Other steps going forward are we've been in discussions about whether we could introduce it to other medications that have similar sort of bioequivalents. So we're looking at commonly prescribed antibiotics. The way we've done it is we're not stopping anybody having IV paracetamol, and we're just putting the power basically in the nurse's hands for them to decide, is it appropriate for them to be having IV paracetamol, or can they have it via an enteral route, an oral route? And if it is then that's great for them. But if that's not possible for them, the IV is still there available for them. So we've been really happy with the positive results that we had. Hopes for the future are that we'll add in other medications, as I say, antibiotics that have similar bioequivalents, and also spread it rather than just an Iron Bevan wide, spread it Wales wide.